Good afternoon, ladies and gentlemen. Uh, my name is Dr. BONIFACE Otim. I'm a doctor of pharmacy and I work with Spring Pharmacy Limited. Spring Pharmacy Limited is located on Wilson Road. We have wholesale and retail outlets, and together we form a network of community pharmacies serving the community. Welcome to this edition of our afternoon podcast. I'd like to share with you a very urgent and critical topic of what is going on right now, and that is about Ebola. I'll take you through quickly, and this presentation is meant to, one, inform the community of what we're dealing with, and two, also to enrich all our colleagues in community pharmacy settings on how we can deal with Ebola at our own level as community pharmacies. I know there can be a lot of questions on why should a community pharmacy be involved, but together, pharmacies, clinics, hospitals, and all other health workers out there, we form a network that support the government in identifying and referring all cases of Ebola. So allow me to talk about Ebola. What is Ebola? Ebola is a viral disease in simple terms. It's caused by a group of viruses called filoviruses. Ebola is also referred to as an hemorrhagic viral disease. By hemorrhagic, I would like to explain a little bit about that. What it does is it affects the vascular system. The vascular system is basically a network of pipeline that helps to carry nutrients, blood, oxygen, hormones, and at the same time to help eliminate metabolic wastes from our bodies. And this includes basically arteries, veins, capillaries, and the heart itself. This is basically P5 science. Well, back to Ebola. So the virus attacks the vascular system. That means it attacks the blood vessels, attacks the heart in complicated stages. It attacks the other organs. So it will lead to organ damage. So what does it exactly do to the vascular system? It will infect the lining of the blood vessels, okay, and makes them very fragile, and it will eventually start leaking. That's where the word hemorrhagia comes from. It also complicates the clotting system of the blood. So there will be a lot of coagulation taking place. This will use all the clotting factors, so leaving the body unable to manage bleeding. So when bleeding occurs, it occurs on multiple sites. In complicated stages, you will see bleeding from the gum, bleeding from the nose, all the open spaces, including the eyes, injection sites, and the body basically cannot manage bleeding. Remember, it has used all the clotting factors. When fluid leaking or bleeding occurs, most of the organs will be affected at this stage, including the liver, the kidneys. They will stop working properly. Then I'd like to talk about the most prominent initial signs. Fever, for example. Why does it cause sudden fever? High fever is one of the most consistent signs. The immune system is trying to respond. It's in overdrive, trying to fight the infection. So, from day one of getting in contact with Ebola, You see sudden fever, we have talked about this. Then severe headache, which can almost be confused with malaria, typhoid, for example. Muscle pain, fatigue. You feel your body is not responding the way it's supposed to respond. When you wake up with a lot of fatigue, a lot of muscle pain. Then, from day 3, I would say you'll start seeing some of the wet signs and symptoms. And this may include vomiting, may include diarrhea, rashes, and then rapid fluid loss begins. From day 7, there will be organ stress, especially the liver and kidneys. And as I talked about in the introduction, there will be impaired blood clotting. From day 8 up to day 12, there will be severe internal and external bleeding. In most cases, in case you notice, unexplained fatigue, unexplained elevation in temperature, normally above 38 degrees. When you experience severe headache, it's very important for you to approach any health facility for more advice. What are the treatments out there? How is it being managed? Up to now, there are about 5 species of Ebola. But the species that we have right now, Ebola bundibujo, there is no current vaccine. So most of the management is supportive. Supportive means we treat the symptoms, we rehydrate. So there will be a lot of rehydration using IV fluids and electrolytes. And of course, pain management. Most preferably, we use paracetamol. Because remember, since the disease causes severe bleeding, it causes complications with the blood clotting system, we advise against use of diclofenac, against the use of ibuprofen, which are the common painkillers out there, but mostly paracetamol. Now, where does that leave us as a community? I want to talk about the prevention. First and foremost, one thing that most people have not talked about, avoid unnecessary visits to friends, family, including close families. If you are at our level and you're at work, try to avoid contact, physical contact with one another. Try to avoid unsafe burial practices, irrespective of the case of death. Try to avoid such places, crowded places. If it's a confirmed death of Ebola of a loved one, allow the approved burial team by the Ministry of Health to handle such events. I also want to talk about the personal protective equipments in place. If you're in a health facility, let's be very vigilant. Let's wear our face masks, medical face masks. I know Ebola may not be transmitted through air. It's not airborne, but still it's good to avoid contact with droplets, since it's transmitted through fluid contact. And that includes sweat, saliva, blood, tears. So if you're out there and you like giving bizu is what we call, what they call pecking. This is the time to avoid such practices. If by misfortune you contract Ebola, and you cure, we recommend at least 7 weeks where you're using condoms. This is very important. We should know that the fatal rate right now is about 50%. That means 1 in 2 cases may lead to death. But like I said, if by misfortune you contract Ebola, please make sure that you isolate yourself, and 2, you inform the Ministry of Health team through government health facilities, and they will take care of that. Other practices that we need to adopt right now, I would encourage individuals to have pocket hand sanitizers. Hand hygiene is very important. Each of us need to take responsibility. For public facilities, including community pharmacies like where I am, I encourage us to have contactless hand sanitizing points, hand washing points with soap. Just know soap kills the virus. Alcohol sanitizers above 70–80%, chlorine will kill the virus. So wash your hands, have your pockets hand sanitizers, wear your masks, avoid public places, and that includes bars, religious gatherings, avoid unsafe, unsure burial places and burial practices. That is the request I put across to us as a community right now. For all your medical supplies, make sure that you have contacts of pharmacies. Adopt the idea of cashless payments. Adopt the idea of minimal visits. I've talked about this and I'm going to repeat this. Minimal visits. Take care of the children. I know children play together. Please try to minimize contacts with actually this, I urge schools out there to make sure that these systems are in place. Sanitization and hand washing. Thank you very much. Again, let me say that we have supplies in stock for sanitizers of all sizes, starting from 60 mils for your pocket up to 20 liters for institutions. We have temperature guns to monitor fevers. We have face masks. We have gloves. So don't hesitate to get in touch. We have delivery team on standby to get in touch with you and serve you. Our telephone contact is 0753 23 24 25. Again, 0753 23 24 25. We have our customer care team who are very loving and ready to serve you. In case you can't get in touch with us, please get in touch with any community pharmacy out there. Make sure that you get all the information that you need concerning Ebola and any other disease out there. Thank you so much.